everyone, and thank you very much for joining us for yet another edition of Mentoring Mental Health and Public Health with Tolu Omodara here on Amoge Radio Communications. It's such a joy and such a delight to have you with us. We are always grateful for you being here with us. You are the reason we do this. Today, we are going to be going into faraway Japan. We'll touch a number of other countries, but we are going to delve into mentoring and mental health in the workplace in Japan. We're going to look at some of the things they have been exploring and some of the reasons why they have been exploring these. And we are also going to see what we can learn in other nations from this. My name remains Tolu Omodara, and we'll be back shortly. Okay, so let's look at why, did Japan have to do what they did. One of the things Japan did was to introduce what they called workplace reforms, right? They introduced what they called workplace reforms. And part of why they did this is, and they did this, by the way, through their MHLW, that's the Ministry of Health, Labour and Welfare, right? They did this because they noticed certain uncomfortable increases in the state of employee mental health in Japan. For instance, they realized that about 58% of employees experience intense stress. 58% of employees experience intense stress. This was according to the Ministry of Health, Labour and Welfare in 2018. Now, as though that was not enough, they also saw that the number of Japanese workers' compensation claims for mental health problems has been on a consistent increase from 200 in the year 2000 to 1,800 in 2018. Can you imagine that? That means that there was a 9 times increase over an 18-year period. So it went from 200 in the year 2000, from 200 Japanese workers claiming compensation for mental health problems in the year 2000, all the way to 1,800. 2 times 9 is 18. So it went from 2,000 to 1,800 over an 18-year period. By the time it was the year 2018, about 1,800 Japanese workers were drawing compensation claims for mental health issues. That was an uncomfortable, consistent increase. As though that was not enough, they also saw that about 32% of business establishments reported that their employees' mental health had worsened in the same 2019 report. 32% of their business establishments reported that their employees' mental health had worsened, and 54.7% said it was what it had been, right? So that means that about 86% of their employees' mental health in Japan was not improving. 32% was outrightly worsening, outrightly getting worse, and about 55% just remained the same. So at least about 85% or 86.7% of their employees' mental health was not improving according to this 2019 report. I'm laying a case showing us why they had to do something about the employees' mental health, and I'm also going to introduce us to what they did with mentoring, what they are still proposing with mentoring, right? Because this is something that other nations can learn from. Now, before we go into that, I want to now say that all of this data that I've shared so far was pre-COVID. Remember, pre-COVID. Now, when COVID happened, I wish I could say it got better, but it didn't really get better when COVID happened. COVID introduced its own challenges, unfortunately, like we all know. Even across the nations, there was increased loneliness, increased depression, and so on and so forth, right? So when COVID happened, they saw that there was an increase in the suicide rates. Since August 2020, the suicide rate of Japanese workers was on the rise, has been on the rise, and the pandemic was, ascribed as one of the main reasons for this negative effects on the mental health of employees. So this mental health of Japanese workers was certainly exacerbated by the pandemic, but note that there was already an increase in the worsening of the mental health of Japanese workers before COVID happened. But when COVID happened, it definitely introduced further challenges. So all of this created a basis for the Japanese government to act swiftly, and they did something that that I think other nations can learn from. This is still Mentoring Mental Health and Public Health with Tolu Omodara here on Amogitrade Communications. It's a joy, it's a delight, it's a pleasure to be doing this with you. Please just hold your breath, catch your coffee, and we'll be back shortly. You're welcome back. So what did Japan do? One of the things the Japanese government did was to enhance their work style reforms. I'll say that again, was to enhance their work style reforms. They have this work style reform program where they, were enjoining organizations to take responsibility for the mental health of their workers. They were already saying that Japanese organizations needed to actively, not just take responsibility, but to actively take responsibility for the mental health of their workers and to promote and protect workplace mental health. Take note of these words. They began to say through a program called Work Style Reforms that Japanese organizations needed to actively take responsibility for the mental health of their workers, and they also needed to ensure that they were, one, protecting the workplace mental health, and they were, two, promoting workplace mental health. I think this is very laudable. I think this is highly commendable, right? So they saw that there was an issue. They looked at a consistent increase over an 18-year period pre-COVID with employee mental health. They saw this worsen, including suicide. A few days ago was the World Suicide Prevention Day. That was September 10, right? And every year, the World Health Organization has been bringing attention to the need to prevent suicide prevention. We must move from just looking at it and discussing it, especially post-occurrence, to now preventing suicide. So one of the things the Japanese government decided to do, especially when they saw this increase in suicide, in workers' suicide rates since the pandemic in August 2020, was to begin to advance and advocate for an improvement in the organizational involvement in employees' workplace mental health, right? So one of the things that this program did was to sort of advance for a reduced reliance on mental health professionals. This is very interesting to me because this is exactly what we have been advocating for since the beginning of this program in July. They want to ensure that there is reduced reliance on mental health professionals in Japanese workplaces. In other words, they deliberately want to ensure that mentors are being trained, are being given the support. When I say the support, the capability support, the competency, the support they require to be able to support or to be able to enhance the efforts of mental health professionals in Japanese workplaces. We've been saying it a lot on this program. Yes, we need psychiatrists, but we do not have enough of them globally. Yes, we need clinical psychologists, but we don't have a sufficient number. And so it is important, we've seen it from research to research, from report to report, from study to study, that mentors can be trained as mental health paraprofessionals. And this is one of the things that the Japanese government did through this introduction of this mental health workplace reforms. They are canvassing for a reduction in the reliance on mental health professionals in mentoring workplaces. Commendable, highly commendable. We think this is something that other nations should learn from. Now, another thing they did practically that I also like is to more or less mandate, right, companies with 50 or more employees to regularly assess their employee stress levels. This is very good. I'll say that again. They mandated companies with 50 or more employees to regularly assess their employee stress level. So if you have 50 or more employees in an organization, you are obligated to regularly assess the mental health or the stress levels of your employees. And those with high stress levels are to be referred to those with the professional skills, the mental health professionals, to further dig down into this issue. This again is something to take note of. Very, very interesting. Now, when these employees with high stress levels are referred to mental health professionals, typically pharmacological care is the first line of treatment. That's people are given prescription medications in Japan. However, in many cases, these employees with high stress levels who are referred to mental health professionals and given pharmacological care as the first line of response are not advised sufficiently on possible side effects and the risks of this prescription medication. I'll say that again. When employees with high stress levels are referred to mental health professionals like psychiatrists, right, typically the first line of response is that they are given pharmacological care. However, many of these prescription medications actually have possible side effects, and they are often the employees who are referred to these professionals and who are given this pharmacological care are usually not advised sufficiently on the possible downsides of those drugs. And so many times when they have used the medications it's time for them, for instance, to stop the use of these drugs, they usually experience withdrawal symptoms, especially with a particular drug. And you can research more into this. There's a particular drug that has been identified, and it said that this particular pharmacological care, this particular prescription drug, for instance, when people are being taken away from it, when it's time for those who have been on this medication to get to move away from it, they usually have withdrawal symptoms, and these withdrawal symptoms lead to social problems, right? It has become a social problem in recent years in Japan, leading to what is called multi-drug prescription problem. Why are we saying all this? We are trying to show why it is important for pharmacological care to be balanced and enhanced with something like mentoring support, right? This is something we are going to debate further, we are going to discuss further, but you also can do your research. But we are showing that part of why Japan as a nation is now proposing mentoring as a sort of not just an alternative, but also an enhancement for the pharmacological care is because they have seen what can be the downsides of these prescription medications. It can lead to social problems, and if you're not careful, the same thing that you're trying to cure with the prescription medication actually becomes worsened in the process of cessation, the process of withdrawal. So currently it's right out there in international debate. The debate is going on, occupational mental health research and so on. They are looking at this drug, for instance, benzodiazepine withdrawal is said to be causing a variety of negative emotional symptoms, including strong anxiety, and the research is currently going on. And while this is going on the international level, Japan as a country is beginning to say, for instance, through their Ministry of Health, Labor and Welfare, they are beginning to introduce a rule to restrict multiple and long-term psychotropic drug prescriptions. In other words, they are beginning to say we have to ensure that we are, minimizing the use of this pharmacological care to treat mental health issues, because sometimes when you do a cost-benefit analysis, the research is indicating that the benefits may not be justifying the cost. When I say the cost, I'm not talking about the financial cost now. I'm talking about the social problems that the withdrawal symptoms is causing, right? What is seen as a side effect, especially when it comes to, cessation, stopping the drugs, and when it's time for them to withdraw from those who are placed on the drugs to withdraw, it is being seen that the cost of the withdrawal on the mental health of the employees, or the mental health of Japanese workers may be worse than benefits. In other words, what you're trying to cure may actually be worsened when it's time for the patients to be taken away from the drug. So in the last decade, the Ministry of Health, Labor and Welfare has implemented this new rule to restrict multiple and long-term psychotropic drug prescription. They're not saying we should not use medication, but the long-term use of medication to address mental health issues is being restricted. Unfortunately, though, it's not yet thoroughly enforced, but that's typical. That's change for you, right? It's not yet typically enforced in the Japanese psychiatric field, but because of a lack of awareness of this problem among the professionals. Do you understand? Even those who are treating mental health issues are said to not be sufficiently aware of the issue of the impact of this pharmacological treatment. So the psychiatrists themselves are not sufficiently aware of the downsides of these prescription medications of mental health. And so because of that, the enforcement of this rule has not been as thorough as it can be. Do you understand what's happening here? The government has already taken a policy decision in Japan to say we're going to minimize the use of pharmacological care on mental health issues, because the research is indicating that what we are trying to solve with the prescription drugs may actually be worsened with the same prescription drug. The mental health issues we are trying to solve may actually be worsened, especially when the time comes to stop the patient from using the drugs, when the time of cessation comes. And so when we do a cost-benefit analysis, at the minimum, we want to make sure we are not placing them on these drug prescriptions for a long term. But those who are supposed to implement, the mental health professionals who are supposed to implement this rule, this policy decision, are not sufficiently aware. And because they are not sufficiently aware, unfortunately, they are still probably giving excessive prescriptions to the Japanese workers. This is still Tolu Omadara on mentoring mental health and public health. Today we are looking at Japan. We are looking at what has been happening there in terms of mental health care. We've looked at some of the things that led to it, increase in workers' compensation claims on mental health. We've looked at challenges like an increase in suicide rate, unfortunately, post-COVID among Japanese workers. And all of these caused the government to come up with what they call the workplace reforms, which I think is highly commendable. And part of what they've said through these workplace reforms is they are going to reduce reliance on mental health professionals in Japanese workplaces. And they have also said they're going to minimize or restrict the long-term use of pharmacological care. That's the use of prescription drugs, long-term psychotropic drug prescriptions as a way of treating mental health, because the research has indicated that if they are not careful, what they are trying to solve through the use of drugs actually gets worsened by the use of drugs. This is still Tolu Omadara on Amo Gateway Communications. If this is mentoring mental health and public health, it's so interesting to see all these things we have been talking about being done and implemented in a nation far away in Asia. And even though they are not there yet, this is, I think, a case study that many other nations can draw from. And we'll be back shortly. You're welcome back. So, it is not just the mental health professionals themselves who are not sufficiently aware, of this problem of the withdrawal symptoms that the medications could sort of activate in those who are using the prescription drugs for mental health issues. But they've also seen that if the patients themselves are also not very up to date, right, about what the withdrawal symptoms can be on them. And so patients, continue taking the medicine to mitigate the withdrawal symptoms. In other words, the patients take the medicine, take the drugs to deal with the issues, but they also take the drugs to deal with the withdrawal symptoms. So the question is, when will the drug use end, right? So even though the underlying disease has been well treated, the patients sometimes have to continue taking the medicine to mitigate the withdrawal symptoms. Now, all of these show that highly stressed people are not currently well informed in that system, and something needs to be done. One of the things that they realize that they need to do, of course, is to update the knowledge of the mental health professionals, right? And to make sure that when they are treating the patient, they are, transparently and fully discussing treatment options with the patient to achieve shared decision making. I'll say that again. One of the things that the Ministry of Health, Labor and Welfare in Japan is doing is to ensure that the mental health professionals are getting updated on their knowledge so that when they are treating the patient, they can disclose a full range of options. In other words, you can have pharmacological care alone, but you can also have pharmacological care augmented and supported with mentoring care, which is non-pharmacological care, but which may be treating the root of your issues. Right now, when the doctors give the patient these options, when they actively take note of the word actively again, when they actively discuss these treatment options with patients, then the doctors and the patients can attain what is called shared decision making, right? And what they do is that this helps them, this helps the patient as well as the mental health professionals to attain better mental health outcomes, right? So it helps them, for instance, to know when to stop the pharmacological treatment, ensuring the patient safety and stopping the patient from over-reliance on the prescription medications. I think this is very interesting. Now, how does this now go forward? So we know now that Japan wants to reduce its reliance on pharmacological care because they have seen the impact of excessive drug prescription. And we also know that Japan is introducing what they call in-house mentoring support. It's not enough to say we are going to, to minimize the use of prescription medication. We now need to know more about what we are introducing as an alternative, as an option. So they've looked at in-house mentoring scheme, which we have been canvassing for a lot on this program. They have looked at it as an option, as a solution, as at the very minimum as something to augment the pharmacological care, and at a certain stage something to become a complete alternative. When the patient is past a risk level, mentoring care can become a complete alternative for the prescription medication and the pharmacological care. But how have they been going about building this in their workplaces, right? Now, let's see this. For starters, they are not there yet. There's still a long way to go for them as far as we can see. However, one of the things that they have started to do or to recommend is the implementation of mentorship programs as part of talent acquisition support. I'll say that again. The Ministry of Health, Labor and Welfare in Japan has been recommending the implementation of mentorship programs as part of talent acquisition support, and they have been doing this since 2018, pre-pandemic. I think this is highly commendable, right? This is encouraging Japanese companies to also provide counseling training as part of mentor education. Take note of that. We've been talking a lot on this program about ensuring that mentors are trained as mental health paraprofessionals. Now, one of the specific trainings, one of the specific skills that the Ministry of Health, Labor and Welfare has been recommending to Japanese organizations is the counseling skill training. So when people volunteer to be part of the mentoring program in Japanese workplaces, the Ministry of Health, Labor and Welfare is saying that they should be trained on counseling skills. And I think this is very critical because it's one of the foundational skills you would need to be effective as a mentor, especially when you are doing mentoring in a way that is targeted at enhancing mental health, right? So, of course, Japanese companies need to, work hand in hand with the Ministry of Health, Labor and Welfare, especially when it comes to implementing the policy, because it's one thing for the policy to be articulated, is another thing for it to be implemented. We just showed the example, for instance, of the restriction on pharmacological care, on some drugs being restricted, but even the even the mental health professionals are not fully aware. So how can they implement what they are not fully aware about? So similarly, yes, the Ministry of Health, Labor and Welfare in Japan has recommended the implementation of mentorship programs as part of talent acquisition support, and they have similarly specifically said that they need to provide, Japanese companies need to provide counseling skill training as part of mentor education. But that is a recommendation. right? Another thing they now need to do, I think even the Ministry of Health, Labor and Welfare needs to work actively with the organizations in Japan, sometimes recognizing some publicly. We talk about using the tool of recognition and reward in strategic human resource management, showcase those who are doing it, use them as case studies, publicly acknowledge them. We're talking about public health here, right? So a lot still needs to be done to sort of make a case for it, advocate for it, publicize it, make it much more common. For now, what we've seen generally, the research has shown that the practical psychological education still needs to be incorporated into the mentor training. I'll say that again, the practical psychological education. So there's a counseling skill, but there's also the practical psychological education. A measure of it still needs to be incorporated into the mentoring training to equip mentors to provide that alternative to pharmacological care for the mental health support of Japanese employees. And by the way, I've been saying it, this is something that other nations can learn from, not just Japanese employees, but also the employees of other nations can be supported through this. That's why we are showcasing them, right? So one thing that we've also seen, according to the previous studies, is that, and this is positive, the previous studies show that mentors who have learned, for instance, about things like prevalence rate, common causal factors, and treatment for mental health problems can support their mentees more empathetically without prejudice and stigma, right? Because there's still this stigma associated with mental health, unfortunately, in many countries. But when you so we've talked about counseling skill training, we've talked about practical psychological education. We are now coming to the attitudinal education, so to say, right? Because the previous studies have shown that when mentors learn about some things like what are the common factors that cause these mental health issues, depression, anxiety, suicidal tendencies, and so on, when mentors know about the prevalence rate, especially across demographic classifications, where are these things prevalent? What are the things correlated with this prevalence? What are the things associated with this prevalence? What are the things that tend to increase this prevalence? When mentors learn about this prevalence rate, learn about the causal factors and the treatment for the mental health problems, the research has shown that they tend to support their employees, their mentee employees, more empathetically, with more empathy, without prejudice and stigma. And this is very critical. When they no longer stigmatize, can you imagine, how can mentors be stigmatizing the mentees they're supposed to be supporting? How then will the mentees feel open to share? So when they no longer have this prejudice and stigma, it simultaneously allows the mentees to more honestly discuss their mental health issues, and this can be very, very difficult in the Japanese work culture, as in many other work cultures. That's the truth. Recently in Amogate, we were approached by an organization trying to do mental health workplace training in an organization, a top organization in Nigeria. And I was excited about this because it shows that organizations are taking more responsibility for the mental health of their employees. So when these mentor trainings happen, it destigmatizes mental health issues. It takes away the stigma, and as it takes away the stigma, it makes the mentee employees feel more comfortable sharing their mental health issues. And this, of course, enhances the impact or enhances the mental health outcomes in a way that pharmacological care and prescription drugs honestly may never be able to do. This is still mentoring mental health and public health with Tolu Omadara here on Amogate Communications. It's such a joy, such a delight to be discussing these critical issues with us on how Japan introduced in-house mentoring support as a way of minimizing over-reliance on pharmacological care and prescription drugs, which of course had been shown to have its downside. Well, let's continue. Please just stay with us a little bit more and we'll be wrapping up soon. But there's so much to talk about and we want you to just, stay with us. So generally, even though more research still needs to be done, more findings still need to be discovered, for now, there is promising feedback that shows that this in-house mentoring program, facilitated by mentors with mental health education, take note, facilitated by mentors with mental health education, can, positively enhance the mental health outcomes. Now, several studies have demonstrated the effectiveness of mentoring in improving mental health. We've been talking a lot about that. Last week, we discussed the one that even showed that even the mental health of mentors themselves tend to be improved, right? Of course, we've discussed before last week several findings that showed the impact, the positive impact on the mental health outcomes of the employee mentees themselves, whether they are employees or young people and so on and so forth. We've seen that the mentoring can significantly improve the outcomes, the mental health outcomes of the mentees themselves. Another thing we also now want to look at as we begin to wrap up is how can mentoring programs, right, how can they be designed? Some of the feedback we've gotten from one of our listeners is how, I think I shared this last week, how do we identify mentors? How do we identify mentees, right? We're trying to design this mentoring program, like I've been saying, Tolu, but how do we identify the right people? So let's just touch on a number of these as we wrap up. Now, some studies have shown that some of the things, and this was also, by the way, advocated by the Ministry of Health, Labour and Welfare in Japan, and they did this as far back as 2013, that the mentoring program needs to factor in certain ethical considerations. Of course, number one is confidentiality, extremely important, right? There must be confidentiality in selecting mentors. You want to ensure that you have taken those who have demonstrated competence, demonstrated behavioral competence as far as trustworthiness goes. Those who have shown that they can maintain confidentiality, extremely important, right? Another thing that they did that I liked, and I think is something to also take note of, is the matching process. I think one of our early webinars on mentoring and mental health, maybe the second webinar or so, we talked about mentor recruitment and matching and measuring, right? This must have been in 2021 or 2020. Now, in the matching process, the Ministry of Health, Labour and Welfare, they are saying it is important to ensure compatibility. You must mandate, in fact, they use that word, you must mandate compatibility between the career aspirations and characteristics of both the mentor and the mentees, right? Of course, while you are taking care to avoid any conflict of interest within the organization, but as much as possible, the characteristics and the career aspirations of both the mentors and the mentees must be matched. That's very important. So remember, the confidentiality is very, very critical. Now there must also be compatibility. We've talked a lot about this in previous editions of the program. You create that environment. The mentoring program should create that environment where the mentees and mentors can more or less select one another, and because mentoring is about relationships, we've been saying that a lot. Allow them to connect, especially important, especially critical. Don't just force mentors or mentees or mentees or mentors. If you try to do that, you may not really have a mentoring relationship. You may just have a mentoring program, but you need more than for the program to actualize its intent. There must be relationships, right? So yes, there must be confidentiality. Whoever you are selecting into the pool of mentors must be those that have demonstrated the ability to be highly confidential. And secondly, there also must be compatibility, right? As much as possible, you must make sure that the mentors are compatible with the mentees. Now, as to the selection of the mentees, they also must be trustworthy. Very, very important, right? They must have a track record of achievement. I think it was one response I gave to one of our listeners who gave the feedback. I said, well, the Yorubas will say, "Omotoba shikmalangbe." You don't want to begin to introduce non-pharmacological care such as mentoring to those who are not ready for it. It's better to leave them with the pharmacological care and prescription medications if they're not ready for the quote-unquote training that comes with mentoring, right? Yes, there's going to be support. There's going to be mentoring, mental health education provided to the mentors. Yes, they're going to be trained with counseling skills and so on and so forth. However, if the mentee is not ready to cooperate with the mentor, then it's better to leave them with the pharmacological care, because they may not yet have the maturity to receive the non-pharmacological treatment which mentoring is, because it could come with some form of discipline, right? But when I say discipline now, I'm not talking about strict discipline, I'm talking about coaching, right? So there is also important to make sure that the mentees have a level of maturity, that they themselves have a record of achievement and also a record of discipline, and they must also possess effective communication skills. It's important. They need to be able to communicate effectively with their mentors. This is still Tolu Omadara on Amogate Radio Communications. We are wrapping up, and we are looking at how do we identify mentors and mentees, how do we also match mentors and mentees. Let me make one more point on matching the mentors and mentees. Now, another thing that is suggested to the Japanese authorities is that descriptive questionnaires and psychological assessments can also be conducted during mentor selection and matching. Let me say that again. Descriptive questionnaires and psychological assessments can also be conducted during mentor selection and matching. I really like this, because this is some kind of an evidence-based manner of approaching the matching process, because it's very important to make sure that the mentors and mentees are effectively matched. Well, this brings us to the end of this, honestly, in my opinion, informative and instructive edition of the program, where we've gone all the way to Far East Asia, Japan, to see the lessons that can be learned, right? One of the main things here is that, yes, we must make sure we reduce dependence on pharmacological care by using in-house mentoring scheme in organizations as an alternative, and not just as an alternative, but at a certain level also as an augmentation, so to say. So when pharmacological care needs to go along with mentoring, beautiful. And when the patient or the mentee gets to a point where he or she can rely only on mentoring support, that would also be great, right? We've talked a lot about what they've done in Japan, and then one of the things to also note is that they are also suggesting that the psychoeducation be added to the in-house mentor training to enhance the workers' ability. When I say the workers who have volunteered to be mentors, to enhance their ability to provide this mentoring support, right? This mentoring support to the mentor for the mental health outcomes, for effective and positive mental health outcomes of Japanese workers. Well, this brings us to the end of this edition of the program. It's been so instructive, so informative. There's so much to learn, there's so much to do, but it is possible. The changes in lifestyle due to the COVID-19 pandemic have led to an increase in the number of young people saying that they have become more apathetic, they have become more lonely. In the United States, I think the Surgeon General produced a report where he said loneliness is the new epidemic. The UK is also talking about this. These remote work issues have increased rates of anxiety and loneliness compared to the days of fully on-site work. Thankfully, some are now advocating for return to physical office. This also has its advantages. But while all of this is going on, while it's still being resolved, or we are still finding midpoints, please, let's do our best to support mental health in workplaces. Let's do our best to improve the quality of mental health outcomes we are having. Let's do our best to support young people. Let's do our best to provide mentoring relationships that can be a safe space, a psychological safe place for people to discuss these issues and to receive the support they need. Let's do our best to ensure we are effectively matching mentors and mentees through some of the things we've discussed here. And please, let's do our best to continue to advocate for mental health effectiveness in our workplaces. Thank you so much for doing this with us. Thank you for listening. Please share. Please like, not for us, but because it's important that this message gets out there. Please share it, share this message, share this program. let people know about it. And more importantly, for those of us who are in policy positions, please do something about it at the levels of government. For those of us who are in decision-making levels in organizations, please try to see what you can do to incorporate these things. And at the very moment, the individual level, continue to watch out for the mental health of those around you. Watch out for signs of depression. Destigmatize mental health issue, take away the stigma, encourage people to seek help and give that help, connect them with mental health professionals when they badly need it, when they've sort of grown out of that stage. Try to also advocate for mentoring support to help to augment the impact of direct mentoring, mental health professional care. And let's continue to build mentoring programs that can support the impact of mental health professionals and that can augment their efforts in a world where we honestly don't have enough of mental health professionals, and in a world where mentoring can also do a whole lot in addition to pharmacological care. My name remains Tolu Omodera. It's a joy, it's a delight to have done this with us. We look forward to having you with us same time, same station next week. Thank you so much wherever you are. Take good care of yourself, take good care of your mental health, take good care of the mental health of those around you, and we look forward to hearing from you. You can check us out on LinkedIn, on Facebook, on Instagram. We are Amogate, and we are looking to transform nations through institutions, organizations, and empowered individuals. Thank you so much, and take good care of yourselves. Have a good one. Bye.